We will discuss another topic, which is the yeast and their disease production. So, what are yeast? So, we know that these are eukaryotic unicellular, round or oval organisms. And during their asexual reproduction, they produce blastoconidia that are referred to as buds or the daughter cells. So, they are sometimes found in the environment of plant material, occur also as commensals on the skin or mucous membranes. They can grow on a wide range of media at 37 degrees Celsius. They can cause opportunistic infections in animals, often related to antimicrobial therapy, which disturbs the resident flora on mucosal surfaces. Immunosuppression predisposes animals to infection. So there are several hundreds of yeast that may occur as commensals, but only few are implicated to cause disease in animals. So we have the three most important genera. We have the genus Candida, Cryptococcus, and Malassezia. For the genus Candida, there are more than 200 species, and the most species implicated in animal disease is the albicans. For the Cryptococcus, there are about 37 species of the genus Cryptococcus, and the one that produces opportunistic infection is Cryptococcus neoformans. For the genus Malassezia, there are many species also known for this genus, and of veterinary importance is Malassezia pachydermatis. So as you can see here in the genus Candida, there are three forms of polymorphic yeast. So for the A, this is the budding yeast cells. For the B, this is the pseudohypa, plural pseudohypae. So this is very unique for Candida albicans. And of course, we have the true septate hypa, which is seen here as with septate or the septum, the cross walls. And for the Cryptococcus neoformans, the characteristic capsule of this yeast organism is evident when stained with India ink. The mother cell and bud have a narrow connection. A prominent mucopolysaccharide capsule is a distinguishing feature of disease. For the Malassezia pachydermatis, these are the bottle-shaped cells. The monopolar budding on a broad base with the formation of a prominent collarette is a characteristic of this yeast. So the yeast, as mentioned, there are eukaryotic, round, or circular or oval single cell or unicellular organism, which are known to produce buds or the daughter cells or the blastoconidia. Pseudohypae is being produced, and also the true hypae. Teleomorphs are either ascomycetes or basidiomycetes, or basidiomycetes or ascomycetes. They are formerly classified as fungi imperfecti or fungi imperfecti. Genera of vet importance have been placed in either the Ascomycota or Basidiomycota. They are found in the environment, in plants, and plant materials. Also occur as commensals on the skin and mucous membranes of animals. They are known to cause opportunistic infections. When they are derived from the environment, they are known to cause exogenous infections, while the one that results from overgrowth of this commensal yeast are endogenous infections. So we mentioned that the three important genera causing animal disease are the Candida, Cryptococcus neoformans, and the Malassezia pachydermatis. In addition, we have also some minor yeast implicated also in causing diseases in animals. These are Macrorhabdus ornithogaster that was formerly placed in megabacteria, known to cause weight loss among birds. That's why it's called going light. We have the Trichosporin B jelly and the Geotrichum candidum. So we will start with the Candida genus. So for the species of Candida, there are more than 200. Candida albicans is the most often implicated to cause diseases in animals, does not have a sexual stage, is known to produce thick walled resting cells known as chlamydospores or chlamydoconidia. So these are some of the appearance of Candida albicans and vaginalis, which is known to be a commensal in the vaginal or the genital area of women. Characteristic of Candida are oval body yeast-like, producing pseudohyphae microscopically. Cultural characteristics: soft, creamy, convex colonies are produced 24 to 48 hours, incubated at 30 degrees Celsius. Antigens, the antigenic specificity depends on the polysaccharide and glycoprotein content. Candida albicans, known to be grow aerobically at 37 degrees Celsius on a wide range of media, including Saborodextrus agar, exhibit polymorphism or pleomorphism in the form of pseudohyphae, produce a thick walled resting cell that we mentioned as chlamydospores or chlamydoconidia. So they inhabit plant materials worldwide, commensal also in the digestive tract and urogenital tract, both of humans and animals. So we have the differentiation of Candida species, base and/or colonial appearance, subculturing onto an indicator medium, allow presumptive identification of Candida albicans, carbohydrate assimilation and fermentation test, commercially available biochemical test kits, features of Candida albicans for presumptive identification, like the growth of at 37 degrees Celsius, reduction of chlamydospores submerged cultures on corneal agar, reduction of germ tubes within 2 hours when incubated in serum at 37 degrees Celsius, and growth on SDA-containing cyclohexamide. For the pathogenesis and pathogenicity, the organism has surface integrin-like molecules that allow adhesion to matrix proteins, surface structures that can bind fibrinogen and complement components. Candida albicans, also known to produce enzymes, proteases, and phospholipases that aids in its tissue invasion. It also exhibits phenotypic switching and biofilm formation that are important in its evasion of host defense mechanisms. Predisposing factors or defects in the cell-mediated immunity, concurrent diseases, disturbance of normal flora due to prolonged antibiotic therapy, damage to the mucosa from indwelling catheters, poor nutrition, stress, affected mucosa is thickened and often hyperemic. Clinical infections. So the organism is known to cause opportunistic infection that may occur sporadically associated with immunosuppression or antibiotic therapy. So the Candida albicans is known to cause a thrush in birds, which is characterized by the presence of whitish circular patches in the mouth crab, proventriculus, and gizzard, which later slough off and ulcerate. Another is systemic candidiasis in cattle, pigs, dogs, and cats, producing pseudomembrane on tongue, esophagus, and stomach. It can cause gastroesophageal ulceration in pigs and foals. Others are mycotic stomatitis in puppies, kittens, and foals, gastroesophageal ulceration, as we mentioned, in pigs and foals, bovine abortion, and mastitis. So this is a table showing the different clinical conditions associated with Candida albicans to different hosts. So we have for puppies, kittens, and foal, there is mycotic stomatitis, pigs, foal, calves, gastroesophageal ulcer, calves, ruminitis, and other conditions. So there are also reproductive conditions produced by this bacteria or by this fungi, like pyometra in mares, reduced fertility, abortion, mastitis in cows. Even the eyes uh, are affected, like the ocular lesions are seen or reported in cats and horses and other diseases. For the diagnostic procedures, biopsy or post-mortem tissue and milk samples for culture and histopathology, tissue sections stained with periodic acid shift or methanamine silver method to reveal the budding yeast cell or hyphae, culturing the fungi in SDA with or without cyclohexamide aerobically at 37 degrees Celsius for 2 to 5 days, colonial appearance on chrome agar candida, and the use of molecular techniques. Demonstration of organism and scraping sections of affected mucosa. And we have here cornmeal agar for culture at 30 degrees Celsius. And if you use serum, culture it with 37 degrees Celsius to reveal the germ tube. For chlamydoconidia, they can be demonstrated in the cornmeal agar. And then treatment are amphotericin B, nystatin, ketoconazole, and miconazole. So for the infections by candida in humans, which is known to be candidiasis. So in humans, this is a widespread yeast. Infections can be short-lived, superficial skin irritations to overwhelming to fatal systemic diseases were reported. Budding yeast of varying size may form both elongated hyphae and true hyphae. It forms off-white pasty colony with a yeasty odor. A normal flora of the oral cavity, that's why it can cause also thrush or white tongue, especially among babies. Pseudomembrane in tongue, it is also called like that. Also found in the genitalia, large intestine, or skin of 20% of humans. It also accounts for 80% of nosocomial or hospital-acquired fungal infections, account for 30% of deaths from nosocomial infections. So the conditions in humans are thrush, which occurs as a thick, white, adherent growth on the mucous membranes of mouth and throat, vulvovaginal yeast infection, which is a painful inflammatory condition of the female genital region that causes ulceration and whitish discharge. Another is cutaneous candidiasis, which occurs in chronically moist areas of skin and in burn patients. For diagnosis and treatment, presumptive diagnosis made if budding yeast cells and pseudohyphae are found. So the demonstration of germ tube, growth on selective differential media to differentiate Candida species, topical antifungal for superficial infections, amphotericin B, and fluconazole for systemic infection. Next, we have the genus Cryptococcus, and as we mentioned, the most important species is Neoformans that is known to produce opportunistic infection. It contains more than 30 recognized species, and the yeast cells are round to oval with 3.5 to 8 micrometer in diameter. And the characteristic or distinguishing feature of this yeast is the presence of a thick mucopolysaccharide capsule that can be demonstrated in India ink stain or music carmine. So the habitat, it is known to be present in the droppings of pigeons and other birds, the soil enriched by the droppings of pigeons, and it utilized creatinine present in the droppings. So we have different serotypes of Cryptococcus neoformans because Cryptococcus neoformans is considered to be a species complex consisting of several serotypes. So the serotype Cryptococcus neoformans variabilis gattii was known to be isolated from the red gum trees or the eucalyptus species in Australia. So what are the characteristics of Cryptococcus neoformans? Microscopically, it is known to produce spherical to ovoid shape with thick capsule. Cultural, it has a rapid growth on SDA or subrhodextrous agar, incubated 7 to 14 days, with a range of temperature 25 to 37 degrees Celsius. Initially produce whitish granular colonies that later become cream, top brown, shiny, moist or mucoid, acquire nitrogen from urea, creatinine, and peptones. So the organism was associated with the following conditions. It is known to cause mastitis. We call this as mycotic mastitis in cattle and nasal granuloma. Also, nasal granuloma was reported in horses, sinusitis, pneumonia, meningoencephalitis, just like in humans, abortion, and cutaneous lesions. Dogs, they have generalized infection with prominent neural and ocular signs. Cats, respiratory, neural, ocular, and cutaneous diseases. Humans, respiratory lesions, which resemble tuberculosis, and meningoencephalitis. So the organism, this yeast is known to be a zoonotic fungal agent. Pigeons with Cryptococcus neoformans in their intestinal tracts can excrete the organism for several months without these pigeons developing diseases. So they are known to be reservoir. So there are the different clinical conditions caused by Cryptococcus neoformans in different animals. So we mentioned this a while ago. For the laboratory recognition of Cryptococcus neoformans, since the organism, this fungal organism has a capsule, so the colonies are mucoid, later becomes dry, cream, tan, or yellowish appearance. So the capsule can be demonstrated with the use of India ink or musicarmine. It is known to hydrolyze urea to ammonia because it can produce urease. Carbohydrate assimilation test can be used. Cryptococcus neoformans can be also demonstrate. The melanin demonstrable in cell wall using Fontana Mason stain or Mason stain. Identification criteria. This yeast has the ability to grow at 37 degrees Celsius. Brown colonies on birdseed agar as a result of phenol oxidase production. Melanin demonstrable in cell walls using the Fontana Mason stain on tissue sections. And we have Cryptococcus variabilis, Cryptococcus neoformans variabilis gatii can utilize glycine as the sole source of nitrogen and is resistant to cannabinoid. Cryptococcus variabilis grubi and Cryptococcus neoformans variabilis neoformans cannot utilize glycine as a sole source of nitrogen and are susceptible to cannabinoid. For the resistance and pathogenicity, it is known to survive well in birds' manure, especially in pigeons' droppings, because of its high creatinine content. Infection starts from inhalation of the fungus or by entry to the skin that will now involve the CNS. So there will be granulomatous destructive process involving the nasal mucosa that will affect the turbinates, the facial sinuses, and adjacent bony structures, and then later on the meninges in the brain, resulting to meningoencephalitis. Mode of transmission are inhalation in contaminated dust. Some yeast may be trapped in the nasal cavities or sinuses. Others are deposited in the lungs. Virulence factors are capsule, ability to grow at the mammalian body temperature, 37 degrees Celsius, production of phenol oxidase that can degrade catecholamine that may result to accumulation of melanin in the yeast cell wall, protecting it against the toxic effects of free radicals. So predisposing factors is number one is defective CMI. So there will be the dissemination or spread of the organism from respiratory tract to brain, meninges, skin, and bones. Lesions range from discrete granuloma to tumor-like myxomatous masses composed of yeast cells in a connective tissue matrix. Small granulomas may be present in the lungs of clinically normal animals. So these are the different clinical infections caused by the Cryptococcus neoformans in dogs disseminated with neurological and ocular signs, horses, nasal granuloma, and others, as we mentioned a while ago. In cats or the feline cryptococcosis, there are four forms: nasal form, cutaneous, neural, and ocular forms. And there are rare cases of mastitis in cattle. For the feline cryptococcosis, so we mentioned that there are four forms. Nasal form accounts for approximately 70% of cases, characterized by flesh-colored polyp-like granulomas in the nasal cavity. Cutaneous lesions affect the head, neck, and face, reported in 30% of cases. There is peripheral lymphadenopathy. Neural form, there are neurological signs evident in 25% of cases. And also, chorioretinitis was reported. Treatment, cutaneous cryptococcosis can be treated surgically. So removal of with parenteral antifungal drugs like amphotericin B, itraconazole, ketoconazole, and fluconazole for 2 months. Latex agglutination test to monitor effects of antifungal therapy. The declining antigen level usually indicate favorable response to the treatment. So diagnostic procedures, examination of wet smear stained with India ink to demonstrate the presence of capsule that appears as a large transparent halo surrounding a cell. In tissue section, Mayer's Mesicarmine method also is used to demonstrate the capsule. Culturing the organism from nasal discharge, the exudates, cerebrospinal fluid, post biopsy, and postmortem lesion. Animal inoculation technique using pigeon and mice, intracranially or intraperitoneal routes, latex agglutination test or ELISA, and PCR assay. So these are the laboratory criteria or methods that we can use to demonstrate also Cryptococcus neoformans based on their isolates, the mucoid colonies, the presence of capsule urease activity, brown colonies on birdseed agar and growth at 37 degrees Celsius, which is specific for Cryptococcus neoformans. And we can also culture the organism or specimen in Sabrodextrus agar with chloramphenicol, but without cyclohexamide, incubated aerobically at 37 degrees Celsius for up to 14 days or 2 weeks. So we have the Cryptococcus neoformans causing cryptococcosis in humans, a widespread encapsulated yeast that inhabits soil and around pigeon, and common infection of AIDS patients, cancer, or diabetic patient. Infection of lungs lead to coughing, fever, and lung nodules. Dissemination or spread to meninges and brain can cause severe neurological disturbance and death. So diagnosis and treatment of cryptococcosis in humans. Demonstration of the yeast using negative stain method, using India ink, biochemical test, serological test, treatment with amphotericin B and fluconazole. Next, we have the Malassezia species that are known to be commensal on the skin of animals and humans. There are many species recognized, but usually Malassezia pachydermatis was the known or only species of veterinary importance. It is aerobic, non-fermentative, urease positive, grow at 35 to 37 degrees Celsius. So Malassezia pachydermatis, formerly known as Pterosporum canis, is a produce bottle-shaped cells, thick-walled and up to 6.5 micrometer in length, reproduced by monopolar budding on a broad base. So habitat is the skin of mammals and birds, particularly in areas rich in sebaceous glands, like the anal region, external ear canal, lips, and interdigital skin of dogs. Other species are known to be lipid-dependent. These are Malassezia furfur, globosa, and Sympodialis. They have been isolated from healthy cats. Identification of Malassezia pachydermatis, the unique budding pattern, demonstrable in microscopic preparation stained with methylene blue. Grow on SDA or subrhodosus agar without lipid supplementation. Colonies are dull, opaque, and cream-colored with smooth surface. Pathogenesis and pathogenicity. It produces or causes otitis externa, seborrheic dermatitis in dogs, associated with immunosuppression. Sebum-altering lipases induce excessive sebaceous secretion. Zymogens in the cell wall can activate the complement cascade, leading to damage of keratinocytes, also producing inflammation and pruritus, or the intense itchiness. So for the otitis externa, production of proteolytic enzymes results to damage of the ear canal mucosa. Excessive production and retention of wax is a consequence of hypersecretion of the cereminous gland. Inflammatory exudate and necrotic debris may accumulate in the canal. For the canine seborrheic dermatitis, there are various predisposing factors like the hypersensitivity disorders, keratinization defects, immunosuppression, and the moist skin folds, especially among other breeds of dogs like Sharpie, Pug, and others, pruritus and erythema accompanied by a foul-smelling, greasy exudate and matting of hair. Treated with miconazole chlorhexidine shampoo and topical and oral ketoconazole antifungal drug. For the canine otitis externa, this is characterized by dark pungent discharge from the ear canal and intense pruritus and head shaking, scratching, and rubbing of ears. This will result to damage to pinna, manifested as a hematoma or the accumulation of blood in the ear. And in the pinna, mucosa of ear canal is painful and swollen. And it is very important that antibiotic sensitivity tests should be carried out. And we can have this eardrop that is given that is known also to be effective against ear mites in dog or the Otodectes cyanotis. Surgical intervention is important, especially in chronic cases. How do we diagnose based on the clinical signs? Laboratory examination of exudate from affected ear canals, biopsy of skin in severe dermatitis, and the characteristic yeast cells in exudates stained with methylene blue. SDA with chloramphenicol at 37 degrees Celsius for 3 to 4 days for culturing the organism. Blood agar and McConkey agar can be used for culture from exudate in otitis externa to isolate other bacterial pathogens associated with Malassezia pachydermatis. So the identification criteria for the isolates are based on the colonial appearance, growth without lipid supplementation, and the characteristic microscopic appearance. So additional yeast that are discussed here are Macrorhabdus ornithogaster, formerly classified as megabacteria or large gram-positive Rhodes bacteria. So this was initially believed to be a bacterium, which are found in the superficial mucosal gland of the lower portion of the proventriculus of budgerigars, resulting to megabacteriosis. But now, based on the phylogenetic analysis of the sequences of the 18S rDNA and 26S ribosomal DNA, it was placed as an ascomycetous yeast, and it is referred now as avian gastric yeast, affecting canaries, finches, parrots, quails, cockatiels, and ostriches. Predisposing factors are poor hygiene, overcrowding, genetic predisposition. Clinical signs are weight loss, diarrhea, and vomiting. So we diagnose this avian gastric yeast or the Macrorhabdus ornithogaster based on the clinical signs, demonstration of large numbers of organisms in the feces or proventricular scrapings stained with Gram stain or Romanowski stain. Post-mortem examination and histopathology is confirmatory, catalase and oxidase negative, and facultative and aero, treated with amphotericin B administered via gavage. Next, we have the trichosporin Bengelii or Bengelii, which is known to be a soil saprophyte, produce yeast cells, blastoconidia, through hyphae, and arthrospores. Non-fermentative and urease positive, causes white teardra, a skin condition affecting humans. Skin lesions in horses and monkeys and mastitis in cattle were reported. Nasal granuloma, mycotic cystitis, and disseminated trichosporonosis in cats with feline leukemia virus. So this one is the last yeast that will be discussed is Geotrichum candidum, which is a mold, and it has a yeast-like colonial morphology, saprophyte in soil and decaying organic matter, isolated from feces of clinically normal animals, occasionally implicated in diarrhea in dogs and apes and lymphadenitis in pigs, and disseminated geotrichosis in dogs. So that ends our discussion in yeast and disease production. Thank you.